Good morning, everyone. My name is Vicky Wong Li Fong. Our group will be discussing a topic that plays a critical role in both our anatomy knowledge and practical eye care. The extraocular muscle, commonly referred to as EOMS. This presentation will cover two main objectives. First, we will explore the muscle action and the cranial nerve that innervate this muscle. Second, we will reflect on how imbalances in this muscle can affect binocular vision, leading to conditions such as double vision or strabismus. Let us start by introducing what is extraocular muscle. These muscles are responsible for controlling eye movement, helping our eyes work together in perfect coordination to maintain binocular vision, allowing us to see single, clear images from both eyes. Let's start by understanding what is extraocular muscle. In total, there are 6 extraocular muscles that control the movement of each eye. These muscles are responsible for allowing our eyes to move up, down, left, right, and rotate. They include 4 rectus muscles: medial rectus, lateral rectus, superior rectus, and inferior rectus, and 2 oblique muscles, superior and inferior oblique. In addition to this, the levator palpebral superior muscle control eyelid elevation, though this is not classified as an extraocular muscle. But together, all these muscles allow the eye to move in precise and coordinated way, essential for activity like reading, following moving objects, or even simple action like looking around the room. My fellow student, Pat, will now share with us the muscle action and its cranial nerve innervation.
Hi, Madam Nadia and fellow students. My name is Petronita Rikni Patrick. Now let's explore the action of each eye muscle and cranial nerve that innervated it. Understanding this is essential, especially when diagnosing conditions like nerve palsies. A is medial rectus. This muscle pulls the eye toward the nose. This movement is called adduction, innervated by oculomotor nerve, cranial nerve 3. B is lateral rectus. Action, pull the eye outward, away from the nose. This is called abduction, innervated by abduction nerve, cranial nerve 6. C is superior rectus. Action, move the eye upward and also slightly pull it inward and rotate it inward. This combination is called elevation, adduction, and intorsion, innervated by oculomotor nerve, cranial nerve 3. D is inferior rectus. Action, move the eye downward with slightly adduction and extorsion, rotating outward, innervated by oculomotor nerve, cranial nerve 3. E is superior oblique. Action, help to depress the eye, move it slightly outward and rotate it inward. Its main action is seen especially when the eye is adducted, innervated by trochlear nerve, cranial nerve 4. F is inferior oblique. Action, help to elevate the eye, move it outward and rotate it outward, extorsion, innervated by oculomotor nerve, cranial nerve 3. A useful mnemonic to remember the nerve supply is LR6, SO4. The rest are 3. Lateral rectus, cranial nerve 6. Superior oblique, cranial nerve 4. All others, cranial 3. For coordinated eye movement, the muscle in different eyes must work together as pair, not as yoke muscle. For example, if you look toward the right lateral rectus pull the right eye outward, and at the same time, your left medial rectus pull the left eye inward. This cooperation is controlled by the brainstem through Herring law of equal innervation, ensuring that yoke muscle receive equal nerve stimulation for coordinated movement. Agonist muscle is the primary muscle responsible for moving the eye in a desired direction. In our right gaze, the agonist muscle is the right lateral rectus. Antagonist muscle is the muscle that opposes the agonist muscle in the same eye. In our same right gaze, right medial rectus is the antagonist muscle. Sherrington law states that increased innervation to a muscle is accompanied by decreased innervation to its antagonist, meaning when agonist muscle contract, its antagonist muscle in the same eye relax for a smooth, coordinated eye movement. Disruption in this coordination, for instance, if one eye weaken, result in eye misalignment, causing the eye to point in different direction. I will now hand over to my classmate Bear to share what happens should we have muscle imbalance.
Hi, my name is Bae Yong Fui. Let us continue with the extraocular muscle imbalance. Muscle imbalance in the extraocular muscle can significantly disturb binocular vision, leading to a range of visual and neurological symptoms. Here, a brief breakdown how muscle imbalance affect binocular vision. First, misalignment of eyes. It causes unequal strength or innervation of extraocular muscle, making one eye may divide inward, outward, upward, or downward. As a result, the brain receives two different images, leading to diplopia, suppression of one eye's image, loss of stereosis or depth perception. Number two, binocular vision dysfunction. It is a condition where the eyes structure to work together due to misalignment or poor coordination. Binocular vision dysfunction symptoms include headache, eye strain, dizziness, or vertigo. Difficult reading or focusing motion sensitivity and balance issue. Number three, impact on depth perception and spatial awareness. Binocular fusion require precise alignment and muscle imbalance prevent proper convergence divergence, which may lead to poor hand-eye coordination, difficult judging distance, or increased risk of fall or accident. Number four, description of hearing and Sheridan laws. So the equal innervation to yoke muscle fields. As in Herring law, our eyes move symmetrically. In Sheridan law, once the reciprocal inhibition breakdown, there will be co-contraction of per antagonist between our eyes. Clinical signs include incomplete or jerky eye movement, overreaction or underreaction of specific muscle or compensatory head posture. Number five, neurological and vestibular consequence. The visual system integrates with the vestibular system for balance. Vestibular system is the sensory system that play a crucial role in balance and spatial orientation. Misalignment eye send conflicting spatial signals to the brain, which can result in postural instability, nausea, and or motion sickness or vision vestibular mismatch. Let's now reflect on how this imbalance directly affect binocular vision in details. Binocular vision depends on both eyes pointing precisely at the same object. When extraocular muscles are weakened or paralyzed, this eye becomes misaligned, leading to double vision or diplopia because each eye sees a different image. The brain structure to merge these two pictures are distorted image into one clear picture. To compensate, adults may adopt an abnormal head posture like tilting or turning to minimize diplopia. In children, prolonged misalignment often leads to amblyopia or lazy eyes, as the brain suppresses input from the weaker eyes to avoid confusion. Consequences of untreated imbalance include development of strabismus, permanent eyes misalignment, loss of stereotypes or depth perception, psychological and social effects due to visible eye deviation. Thus, maintaining proper muscle balance is critical not just for vision clarity but for depth perception, coordination, and even self-confidence. Another common occurrence for muscle imbalance is strabismus. When specific cranial nerves are affected by injury, disease, or compression, the muscle that supply become weak or paralyzed. This is known as a nerve palsy. In CN3 palsy, most of the extraocular muscle are affected, except the lateral lattice and superior oblique. The affected eyes typically appear down and out because the lateral lattice and superior oblique are unopposed. Other symptoms include ptosis and dilated pupil due to loss of parasympathetic innervation. In CN4 palsy, only the superior oblique muscle is affected. Symptoms include vertical diplopia, meaning patients see double vision, one above the other. Patients often tilt their head to the opposite side to reduce double vision. In CN6 palsy, the affected muscle is the lateral lattice muscle. The affected eyes turn inward. Horizontal double vision occurs, especially when trying to look toward the affected side. My classmate Shifong will share further on the treatment and management of the muscle imbalance.
Hi, good day everyone. My name is Kok Shifong. I will now share with everyone the management and the treatment for eye muscle imbalance. How do we diagnose, manage, and treat muscle imbalances? Diagnosing muscle imbalances involve careful observation of eye movement and identify the restrictive or overacting muscles. Then, we take note of the abnormal head posture. Finally, we perform cover tests to identify the type of misalignment. Management options includes eye exercise to strengthen the weak eye muscle, using of prism lenses in glasses to realign the images temporarily, and using botulinum toxin injection, often known by its brand's name Botox, to weaken overacting eye muscles. And finally, surgical corrections if non-invasive method fails, often by adjusting the length or the position of the eye muscle to restore alignment. In case that are caused by systematic diseases like diabetes or tumors, addressing the underlying causes is essential. Understanding the extraocular eye muscles functions and the nerve control is critical for eye care practitioners to identify and treat motility disorder early. This case highlights how understanding muscle actions and nerve innervation allow us to diagnose CN6 palsy correctly. Without this knowledge, differentiating such conditions would be challenging. In this case study, Mr. Ahmad, who complained of double vision for 2 weeks and got worse, especially when looking right. Upon doing preliminary eye examination, we understand that Mr. Ahmad is a diabetic patient for 15 years. And upon eye examination, the diagnosis is right abundance nerve CN6 palsy, most likely due to his diabetic microvascular ischemia. The management and treatment proposed are blood glucose control, prism glasses for temporary relief for diplopia, recovery monitor over 8 to 12 weeks, early detections and appropriate management including exercise, prism or surgery can restore proper eye alignment and prevent long-term complications. Mr. Ahmad has a full recovery of lateral rectus fractures after 3 months. To conclude our topic of EOM, we have 6 extraocular muscles coordinated by cranial nerve 3, 4, and 6 are essential for precise synchronized eye movements. We also understand that muscle imbalance disrupt binocular visions, leading to strabismus, diplopia, and in children, potentially permanent vision loss to amblyopia. We need proper eye alignment, and coordinated muscle sections are vital for clear, single, and comfortable vision. Early detection and appropriate management, including exercise, prism, or surgery, can restore proper eye alignment and prevent long-term complications. In summary, maintaining healthy extraocular muscles is crucial not just for vision clarity, but for a patient's functional ability and quality of life. Thank you for your kind attention today and have a great day ahead.